Hi, my name is Eva and I'm going to be talking about PTSD. Post-traumatic stress disorder is a mental health condition that is triggered by a terrifying event. This condition is caused when you experience or witness any traumatic incident and can lead you to having symptoms after the occurrence, but when treated can help reduce such things you may be experiencing that has affected you negatively. Anyone can suffer from PTSD. You probably know somebody suffering. According to the PTSD website, approximately 7 or 8 out of every 100 people will suffer from PTSD. Throughout this presentation, I'll talk about the causes, symptoms leading, and the treatment methods involved in PTSD, as well as PTSD in kids. First, I'm going to start with the most common events leading to post-traumatic stress disorder. This includes childhood abuse, natural disasters, such as hurricanes, earthquakes, fires, serious car accidents, sudden death of someone close, illness, and combat, etc. Almost any traumatic event can lead to PTSD. In the Grenfell Tower, it is said to be one of the biggest fires of its kind in Europe. More than 10 million euros was spent on the treatment of mental health of those affected. In that year, 2,674 adults and 463 children were screened for symptoms of PTSD, according to The Guardian 2019. Next is symptoms leading to PTSD. The Mayo Clinic website gave information that symptoms usually start to occur anywhere from 1 month to several years after the occurrence of the event. Symptoms of PTSD are categorized in 4 different groups, including intrusive memories, avoidance, negative changes in thinking and mood, and changes in physical and emotional reaction. Intrusive memories often contain unwanted memories of the event, flashbacks, upsetting dreams, and nightmares. Avoidance includes avoid thinking or talking about the event, as well as not going places or seeing people that remind you of the event. Negative changes in thinking and mood include negative thoughts about yourself, hopeless about the future, finding it difficult to maintain close friends. And changes in physical and emotional reaction include being easily startled or frightened, always on guard, trouble sleeping, and overwhelming guilt. Then is treatment methods involved with this disorder. PTSD can disrupt many aspects of your life, such as your job, relationships, and health. If you have disturbing thoughts and feelings about the traumatic event over a month and it gets severe, you should go to a doctor. Going to a doctor will help your symptoms spiraling out of control. There, they will perform a physical exam and do psychological evaluation. From there, they will figure out which treatments are best for you and which medications will do the best in helping keep your symptoms under control. There are several different medications you can use. Antidepressants help with depression, anxiety, sleep problems, and concentration. Next, there is anti-anxiety medication, which helps with severe anxiety, but usually is used only for short periods of time because it has potential for abuse. Lastly, Processin. The medication helps reduce nightmares in some people with PTSD. Lastly is PTSD in kids. According to the U.S. News 2019, studies have showed that 14% to 48% of kids will be exposed to traumatic events in their life, and that 1 to 15% of those kids will develop PTSD. Kids experiencing traumatic events may have emotional and behavioral problems, and that is normal, but when it is reoccurring is where it becomes symptoms of PTSD. Kids who experience this often exhibit more clingy behavior, such as difficulties separating from parent or wanting regression that includes always wanting a special blanket or a stuffed animal around them. They also have increased fear and sadness. It is essential for children experiencing PTSD that they are assessed by a professional who is skilled in helping with developmental responses to stressful events. In conclusion, PTSD is a complex disorder and can cause people to suffer in such ways that their past is always present and live day to day where they are haunted by the memories of the traumatic events. Well, you may know somebody suffering from PTSD. One thing people usually do to help is provide support. It is normal for people suffering with PTSD to withdraw from family and friends. It is always important to respect their boundaries. Comfort can always steer them from overcoming feelings of hopelessness and grief. When providing comfort, people have to take things into account. First, example, they should manage their own stress. The more relaxed they are and the more calm the individual is, the better they will be able to help. Second is be patient. People should understand that the recovery process takes time. So the most important thing to do is stay positive. And lastly, they should educate themselves about PTSD. The more an individual knows, the more they can help and stay connected with their loved ones throughout the journey of PTSD. Thank you for coming to us.